So fertility preservation and fertility in general is really the question that we get down to is, can you build a family that you want to in the way that you want to in the future? That's really what we think about when we talk about, can we preserve fertility? Can we protect fertility for the future? And so it's something that's very important to our patients in the long run, and it's seldom talked about, or at least not frequently enough talked about in the short term before we start therapy. Really though, the time to preserve fertility is before we start therapy. After we give chemotherapy, we can't take it back. And so there are options for both young men and for young women and for those who identify differently to preserve fertility and to protect it for future, so that really, again, getting back to the end goal, is that you're able to build the family that you want to in the way that you want to in the future. We know from studies that discussing it, even if there aren't options or even if it doesn't work out, discussing it decreases the stress of just having those decisions later in life. If you think about it and you talk about it and you have some ability to choose either therapy that would be best reflect those needs and those desires, and also choose interventions to preserve that fertility if those options are available. So fertility preservation really should be kind of throughout the patient's treatment journey, to be honest, most importantly before we start therapy. As I mentioned, once we give chemotherapy, we can't take it back. And unfortunately, and how I talk to patients, so young men have a lot of easier ways of preserving fertility than young women, and their fertility is usually less impacted than young women who undergo chemotherapy. How I talk about it with young women is that each woman, each female-bodied person is born with some certain level of fertility. And we know that based on the fact that plenty of women have difficulty conceiving naturally without having cancer and chemotherapy previously. So what chemotherapy does is it kind of decreases that fertility. The problem is we don't have good measures of that. Our science hasn't advanced enough to know where people are at on the spectrum. And so even if the treatment isn't expected to decrease fertility to the point where it would impact somebody's ability to build a family in the future as they so choose, we don't know that for that individual, which is really in the end all we care about. We care about the person in front of us. For that individual, I can't say for sure what their level of fertility is, so I can't really say for sure how our chemo is going to impact it in the long run. So the opportunity to do something about it is really in the start, before therapy, to either, if there's time, to preserve the fertility through, basically scientific means, so either preserve semen and freeze it for the future, or for young women, either harvesting eggs, or actually even having ovarian tissue saved for the future is an option nowadays. And so there's lots of different options that are out there. And we do have some medicines that we're investigating that could prevent the damage that chemo does to fertility, but we're really early on and we don't know how effective those are. So looking at standard options as far as preserving eggs, freezing semen, things like that are really the options that people should be considering as the kind of tried and true methods. So that's why I say that fertility care is really throughout therapy and afterwards too. We do have some ability to be able to kind of measure someone's general fertility levels. There are both blood work, there's ultrasounds, but really it's imperfect. And just as I mentioned, we don't really have a good way of measuring what fertility levels are there before therapy. After therapy, we can measure and kind of get an idea, but it's not perfect. Really, the tried and true method is to try to attempt to become naturally pregnant and see if it works in the end. If you're, especially if you're a young woman, if you're having periods, that's the best way to try. And early on though, knowing if you've had cancer and therapy beforehand, seeing an OBGYN or seeing a reproductive endocrinologist who has expertise and be able to direct you about kind of how long you should be trying, what other options are there, is this something that's really feasible, or should we be talking about other ways to build family at this point, is a good thing to be involved with early on so that you can build that relationship. That availability is highly variable. The cost of it is highly variable. The coverage of insurance is highly variable. And so all of that is something that's really hard to give kind of individual recommendations for. But what I would say is, find somebody who has expertise in reproductive endocrinology or fertility in general, and try to see them for general care and check in after your therapy if that's something that's important to you and that you're interested in exploring. think the important thing is that being an advocate for yourself, or having somebody who's going to advocate for you. If you're partnered, if that's your partner that you feel more comfortable asking, if you have family that you feel more comfortable asking for you, then having them do it. So it doesn't always have to be yourself, but at least having an advocate that you've talked about or talked to about this topic before is just as helpful if it's not yourself. But really, in the end, I say, people are their best advocates. So it's really just asking. I think you don't have to ask the right question. There isn't a right question to ask, but just ask something about, how does this therapy impact my fertility? And is there something that I can do to make sure that my fertility is preserved beforehand, or are there other options that would be less impactful on my fertility? But really just asking about how this therapy impacts your fertility should really hopefully clue in your treatment team to kind of have that discussion, to go over the risks, go over the options, and to be able to refer you to somebody who would have more expertise in that if they don't. So there are a lot of great resources that are out there. I always say first to go to your treatment team and ask what resources they prefer. Sometimes they'll have resources that are specific to the area, and so local resources can be helpful, especially for financial help and for other support groups or meetups or other kind of psychosocial support in general. Then foundation have excellent resources. So the Lymphoma Research Foundation, Leukemia Lymphoma Society, American Cancer Society, all of these have great resources. I've been speaking specifically about fertility. Livestrong specifically used to do a lot more work in fertility, but they still do a good amount of work in fertility. They have calculators that are online that can kind of help you, assess your fertility risk of your treatments. They have resources financially sometimes to help with the medicines that are needed for young women specifically to preserve their fertility. And they have a little bit more detail about the fertility piece specifically. And so all those resources are available online. I would usually try to suggest to go to those more than any of the social media kind of outlets that are available to you, and see also though, ask your team, because there's usually a lot of community-based resources, and sometimes seeing people in person, talking to people who have gone through it. Or actually the Lymphoma Research Foundation has an ability to connect patients with each other that can be really great for peer support. And so peer support, other patients who have gone through it can also be excellent resources.